Hi guys, today I'm going to talk about cervical screening. This is very important as it often appears in medical exams, and it's also very important as you will need to know about it in your day-to-day life as a doctor, whether you're a GP or a hospital physician. So cervical screening allows us to detect precancerous changes in the cervix, and this is useful and it has reduced the incidence of cervical cancer in the UK. And women are screened for cervical cancer between the ages of 25 to 64. Screening will occur every 3 years in women aged 25 to 49 and every 5 years in women between 50 to 64. And screening takes the form of a smear test, and a smear test is when a speculum is placed into the patient's vagina to visualize the cervix, and a small brush will be then inserted into the cervix, and it will be used to brush off any cervical cells. These will be placed in a container, and the cells will then be sent off to be analyzed. And when we talk about the cervix, we are talking about a tubular structure that connects the uterus and the vagina. And the cervix is composed of two parts: the endocervix, which has columnar epithelium, and the ectocervix, which is continuous with the vagina and has squamous epithelium. And there's also a transformation zone, and this is the area where the columnar epithelium of the endocervix undergoes metaplasia to become squamous epithelium. And this is very important as it is this transformation zone that is most vulnerable to cervical cancer. And why do we think this might be? Well, the answer is simple. This zone is already undergoing a lot of changes, so it's more prone to transformation of the cells, and it is therefore more prone to cancer. So the cytologist will look at the cells sent off in the smear test, and what they're going to look at is whether the cells are normal or dyskaryotic. And if they are normal, that's great news for the patient. The patient's just told to continue getting their smear tests as advised every 3 years or every 5 years, depending on their age. However, a patient may get results that the smear came back dyskaryotic. So there's 3 grades of dyskaryotic: mild, moderate, and severe. And if mild, the patient will be told to go for a HPV test, or will have a HPV test done. And this is very important, and I'll talk more about it in my cervical cancer talk, as HPV is the main risk factor for cervical cancer. So if a patient tests negative for HPV, they can go back to their normal screening for cervical cancer. But if a patient tests positive for HPV, they will need to have further follow-up care. So they will need to have a colposcopy, and this will be done normally as an outpatient. If a lady has moderate or severe dyskaryosis, you jump straight in with the colposcopy. You don't have a HPV test. You just refer them straight to the outpatient clinic for colposcopy. And colposcopy involves inserting a speculum into the vagina, just like with the smear, but the instrument you're using in this test is much more specialized, and it allows for magnification of the cervix. And then the clinician often puts stains on the cervix to differentiate dyskaryotic cells from normal cells. And he or she may also take biopsies they should be taking biopsies and sending these biopsies off to histology. And then histology will grade the changes and the 3 grades of SIN 1, SIN 2 and SIN 3. And SIN stands for cervical intraepithelial neoplasm. And some people often get confused between SIN and dyskaryosis. They think they're the same, but they are not the same. Dyskaryosis refers to abnormal cells in the cervical smear, but SIN is a histological diagnosis. It's based on the biopsy. So SIN 1 is the mildest form, as the name suggests, and it may require no treatment at all. So the cervix may return spontaneously to its normal state, return naturally to its normal state. But of course you'd need follow-up smears to monitor this and make sure that it's returning to normal. However, SIN 2 and SIN 3 require treatment, and the treatment that is given is known as the LLETZ procedure, or large loop excision of the transformation zone. And this is done using the colposcopy, and this is done often as an outpatient. And what LLETZ does is that it removes the abnormal margin of the cervix. This is very useful in getting rid of pathological cells, abnormal cells. However, there is one disadvantage of LLETZ in that it shortens the cervix. So when you're removing cells off the cervix, your cervix is going to get shorter. And this can cause complications with the cervix. It can lead to cervical incompetence, and this can cause problems if a lady goes on to have babies. It can pose complications with labour. So that is the key management of cervical abnormalities such as SIN, and that is the management and workup you do with cervical screening. That concludes my presentation. I hope you enjoyed it, and if you did, please don't forget to hit the like button and subscribe for more medical videos.